Good evening, you're watching NDTV with me, Rishika Barwa. Over the course of the next half an hour, we will take your calls live on the broadcast. We have two noted doctors joining us who will answer all your questions related to the novel coronavirus. We have with us Dr. Tejas Kamat. He's a diabetologist from a diabetes care clinic joining us from Goa. We also have Dr. Shehla Shaikh. She's an endocrinologist joining us from Mumbai. So appreciate you doctors being with us. Our focus this evening, is on the rise in asymptomatic cases. We've seen, the World Health Organization, we have statistics coming in, from cases in Maharashtra as well, where around 80% and sometimes even over 80% of patients have been seen to be asymptomatic. So I'm going to ask, maybe Dr. Shaikh, if you want to take on the question first, on how does it work? How can you have a disease which has an incubation period for 14 days? You can be an asymptomatic carrier, maybe never exhibit the symptoms, but could pass it on to someone for whom it could prove to be a lot more dangerous.
Hi dear. This is actually the pathognomic feature of the present coronavirus that we are dealing with at this point of time, that it has an incubation period of almost 14 days. And that's the reason why it becomes more infectious and potentially more dangerous, because it is during this period of 14 days when you may be asymptomatic, you may have absolutely no symptoms because of a number of hypothesized reasons, but you may be transmitting the infection to others, and so you may be a potential carrier, a potential person who would transmit this to a number of other people who could potentially get infected, who could have much more severe disease, and in whom it could also be treated.
All right. If I could also ask you, Dr. Kamat, the same question, on asymptomatic carriers. The statistics so far have, shown that there could be as many as 80% of people who could actually have contracted the coronavirus, never exhibited any symptoms and made a recovery on their own. That's the trend that one is seeing, but that proves to be extremely dangerous. A lot of countries in Europe have actually seen a spike. We have that graphic up on our screen of, India versus the world. You're looking at the number of tests, of course, that have been conducted in Italy, which is much more than India. But what we're essentially talking about is the fact that asymptomatic carriers can prove to be far more dangerous than those who exhibit symptoms.
Absolutely, Rishika. So the point is that there could be people around us whom we know that they are perfectly fine, healthy. They don't have any symptoms like cough or fever, but probably they have come in contact with somebody who had COVID-19 and they've contracted the virus, and they are spreading that virus around to others who are in contact. But they themselves, because of various reasons like their immunity has worked well, they themselves have not been infected. So we have to be extra cautious, and as the WHO has been saying, and the government has already started that strategy of testing more. That's very important, to test more so that this asymptomatic carriers we can identify, probably quarantine them, home quarantine, or in a special hospital, so that they reduce the spread of infection to others in the community.
I will at a later stage also ask the doctors about recoveries in asymptomatic patients. If you don't exhibit any symptoms, does the disease just go away on its own? But I do believe that we have our first caller on the line. Harmeet Singh is dialing from Himachal. Go ahead, Mr. Singh.
Hello.
Yes, go ahead, sir. Good evening.
I have a question. Lots of families are not accepting the dead bodies. And people are, the government is going to be taking them through their funeral and everything. What's your take on the dead bodies? Are they infected?
All right, Dr. Shaikh, do you want to take that on? The bodies of those patients who have died as a result of the coronavirus.
Rishika, the body is, once the death has taken place, the body is not infectious per se. But a gathering which can occur potentially in a funeral can become a area of concern, because when there are a number of people which gather to take part in the last rites, that can become a potential area, because the person who has died of COVID-19 could potentially have another contact within the family members, immediate family members, or within the other contacts who could also be COVID positive. and that can become a spiraling area of concern, because that can lead to a spread of the virus in a huge number of people out there.
All right, our next caller, Shankar, is on the phone line from Noida. Go ahead.
Okay, I have two questions. Rishika, the first question is, you mentioned about asymptomatic people transmitting the virus. So I just want to ask you, if an asymptomatic person is not sneezing or coughing, how can he transmit the disease? Number one. And the second question is related to the use of masks. Now, just going for a walk within the society, can we use the mask, multiple times, or you just expected to use the mask, the surgical mask, or any other mask that you get it ready-made?
All right.
Are you expected to use them only once, or you can use them many times after washing with the soap?
Let me ask Dr. Kamat to take on both those questions. Dr. Kamat, firstly, of course, how does an asymptomatic person, if he's not coughing or sneezing, transmit droplets? And second, on mask etiquette.
So, Rishika, if I tell the viewers about facts, on an average, every individual touches the nose, ears, or mouth more than 1,000 times in a day. So we may not be coughing, and the droplets don't only spread when we cough or when we sneeze; they also spread when we talk.
Right.
So that's how asymptomatic carriers, even they may not be coughing or sneezing, they might be touching their mouths and their nose, and those droplets could be transmitted to the maybe handles of the doors or some other areas, and you touch them and then you touch your face, then
right.
the risk of you getting infected. So that's how asymptomatic carriers transmit this virus. The second part of what the caller has asked is very important, and I thank him for asking this, and would like to give me 2 minutes to answer this in detail, because there's been controversy about the use of masks, and I want to clear that in a very detailed manner. So recently, just 2 days back, the CDC in US has recommended the use of masks for most of the people in the community. However, the government of India, the Ministry of Health and Family Welfare, as well as the WHO, has still now not recommended the use of masks for general public. Now, if we are using a mask, there are some essential things that we have to understand, because this could be a counterproductive if we are not using them properly. So first, there are 3 types of masks. I won't go into details, but what is recommended for general public is simple cloth mask that is recommended by the CDC. Now, there are 3 important things. One is when to wear it, how to wear it, and how to dispose it. It's equally important to understand this. So first, when you wear a mask, you have to first wash your hands properly with a soap and water, or with an alcohol-based sanitizer. Do not touch the front part of the mask. Just hold the straps and wear it around your nose.
Right.
It should properly cover your nose, mouth, and your chin.
Right.
There should be no gaps. It's important to understand it should not be touching the mask. I've seen people who are just taking it down on the neck and then again putting it back. That's wrong practice. We are increasing risk of virus spreading that way. Masks should not be reused, and ideally they should be disposed of after 6 hours maximum. We should be frequently changing the mask. And when we take out the mask, don't touch the front part of it. Take it from the back, from the straps, and dispose it off properly. And after disposing it off, remember to wash your hands with soap and or a sanitizer.
Right.
That's very important.
All right. So I think that's extremely important information, because at a time when even the Indian government has issued an advisory to people to wear cloth masks, especially when they are stepping out, if at all they need to step out, it's extremely important to know that there are a whole list of do's and don'ts on how to use a mask in order for it to actually prove to be effective. Jogeshwar Rao, our next caller, is on the phone line from Hyderabad.
Good evening, Rishika and respected doctors.
Good evening, sir. Go ahead.
Good evening.
Actually, this is about one question bothering me since few days. Yesterday, that human transmission to tigers in US, that was not possible few days ago, and it has been proved. My question is whether flies, that makkhiyan, ghar mein,
Right.
That from the format surfaces to, if they can they carry it to my face?
All
That
right.
is my first question. Second brief question. Another question is there. That is the cured persons. Any close monitoring by medical agencies are there, or there is no need?
All right. Dr. Shaikh, do you want to take that on? Can flies or mosquitoes, be carriers of the infection? The case of the tiger testing positive in America raised several questions.
Yeah. I know, Nadia, the tiger tested positive, and that has created a lot of confusion because the other 3 lions in the zoo also tested positive from the person who was looking after them. But at this point of time, we have no evidence that flies actually are a carrier of this virus. So it is too early for us to say that the flies are carrying this virus. To add to something which Tejas was answering earlier, asymptomatic carriers also are carriers via fomites. So, when they touch a surface which potentially could have the virus and which another member touches, that can also potentially lead to spread. And surfaces need to be kept clean with an alcohol-based wipe if possible, as often as possible, because on steel surfaces and plastic surfaces, the virus can last for almost up to a period of 3 to 4 hours, Rishika, and we should be careful about that.
All right. The other question that was also asked, I think, is extremely important. Dr. Kamat, do you want to answer the second question?
No, I'm sorry, I didn't get the second question very well. Can you just...
Yeah, we didn't hear it.
All right. I think the first question was on, on of course, flies being carriers of the coronavirus, which I think you've answered that there isn't adequate, information that is, of course, available. But I think it's important because we've been talking about asymptomatic carriers, and I want to, once again, sort of just understand. Maybe Dr. Kamat, if I can come to you on that. How is it that asymptomatic carriers then get cured? Is it the body's mechanism to fight the infection that just cures them of the infection? Do they never exhibit any symptoms and can get 100% cured of the disease?
So I would say it's very lucky to have asymptomatic carriers because they have not even got a disease. So there's and one thing I would like to clear over here is again there's a misunderstanding about the general public. And there is a lot of panic because they feel most of the public are not aware of the mortality rates in corona. So it's around 80% of the patients recover spontaneously without any active medical treatment. So that's that's the exact question that you asked. How do they get cured? This 80% symptomatic as well as asymptomatic patients. Remember, we have something called as innate immunity, our immunity, which is enough to fight most of the infections that we get. So it's because of this immunity that we are able to fight these infections. Any common cold or some other bacteria, viruses that our body fights, that's the same immunity that is destroying this virus as well in some point of time. So be it asymptomatic or symptomatic cases.
All right, very very interesting, and a lot is now beginning to be researched and written about asymptomatic carriers, because it is believed that in several parts of the world that have seen a huge spike in cases, it is asymptomatic carriers that have primarily been responsible for that rise. Zaira, our next caller, is dialing in from Srinagar. Go ahead.
Hello.
Yes, go ahead.
Good evening, sir. I was in abroad and I came back to Kashmir, and due to COVID-19, I was quarantined for 14 days. Till now, I crossed 23 days, and so far, I'm all right. Now, my question is, how many days are required to assure a person that he's infected and can be back to family? There are 2 positive cases around you while during the quarantine.
All right. Dr. Shaikh, do you want to take that on? I think there's a lot of apprehension. Even people who complete quarantine period, especially those with travel history, are apprehensive about whether they should, meet with their children or, the elderly people in their families.
Rishika, at this point of time, the word quarantine is synonymous with a lot of discrimination. The moment you say quarantine, it's leading to a lot of discrimination from a lot of people around you, which even we as doctors are facing, to be very honest with you. But, a patient who has come from abroad, a 14 days quarantine is the standard quarantine period which is accepted. Having said that, as far as infectivity is concerned, in some patients it has been seen up to a period of almost 27 to 30 days. But the infectivity of the virus reduces significantly after a period of 14 days. So a period of 14 days is adequate for quarantine, which is accepted universally according to all the guidelines.
Mr. Sundar, can you hear us? All right, we seem to have lost that line. We're going to try and reconnect. All right, Mr. Sundar, can you hear us?
I have a question on
Can I go through, madam?
Yes, please. Ask your question, sir.
Fortunately, we are in the second stage and we have not got into the third stage. That is a good news for India. But around the corner on 14th is our lockdown that is getting over, and there might be a lifting up of the lockdown. And my question is, by lifting the lockdown, are we not potentially putting our people to move into the third stage, which will be more worrisome than what we are today? So what are the chances of moving from the second stage to the third stage by lifting the lockdown, madam? Please.
All right. Dr. Kamat, do you want to explain also to viewers, what the difference between stage 2 and stage 3 is, and, could potentially a lockdown, if at all it is lifted on the 14th of April, could it lead us into the next stage?
So this is what we are talking about is a pandemic. So there are 4 stages according to WHO. There are 4 stages of a pandemic. Stage 1 is the foreign people who had a foreign travel history. So those are isolated cases in stage 1. Stage 2 is local transmission. So this foreign travel people who have come and infected some people around their locality. So that is stage 2. Stage 3 is community spread. So community spread is something that you don't know from where the cases are coming. So one person is infected, multiple other person, and those people are infected others, including the asymptomatic carriers. So we don't know where these patients are coming. For example, I think we are just entering phase 3 in some clusters.
Right.
It's not all over India, but there are some clusters in which last 2 or 3 days we are entering stage 3, and it's very important to contain the disease at this stage. I am sure you have heard this news just yesterday that a tea seller just outside the Maharashtra CM's and they don't know from where that person has got infected. So that is what stage 3 is. That's the basic difference between stage 2 and stage 3. That stage 2 we are able to identify from where the person is getting infected. Stage 3 we don't know. And the second part of the question, so I think it's that we have to leave it up to the government to decide. But I think there won't be a complete relaxation of the lockdown. It might be relaxed in some. For example,
anything about the lockdown at this moment is still speculative, and I think it's everyone's anxious about it. But I don't think that the doctors on the panel, perhaps the right persons to answer on what the government is going to decide. No official word on that yet, but that's of course a separate story. Ajay Borthakur is joining us from Guwahati on the phone line as well. Go ahead.
Yeah. Good evening, doctors, and good evening, madam.
Good evening, sir. Go ahead.
Yeah, I am 62-year-old. I am from Guwahati, and I have diabetes as well as I have a little bit of cardiac problem. I went to Delhi for checkup with for Tejas Kamat, and I came back to Guwahati on 22nd. And since then, I was completely quarantined myself, home quarantine. I am living alone in my home. I am living in a society in a flat where I am living alone. And my society people and other people are suggesting me that I should go for, though I have crossed 16 days quarantine, I have been asked to go for a test. But I have no symptoms whatsoever it may be. Neither cough, nor cold, nor fever, nor breathlessness, nothing else.
All right.
I asked the honorable doctors over there whether I should go for any test at this juncture or not.
All right. Very interesting question. Dr. Shaikh, do you want to take that on? Because I think, that's exactly what we've been talking about, asymptomatic carriers. Now, here's a person, with 62 with a predisposed condition. What do you recommend? Should he go ahead and take the test?
Mr. Borthakur, at this point of time, since you've already very, very sensibly, I would say, completed almost 16 days of quarantine, you do not require any test. All the guidelines at this point of time are not recommending testing in, even if you are elderly, if you're 60 plus, you have 2 comorbidities actually. You're a diabetic patient, you also have cardiac issues. So you are actually, an immunocompromised patient who would be at more risk of infection. But since you have already sensibly quarantined yourself for 14 days, at this point of time, you definitely do not require any further investigation.
All right. Our last caller, RK, is on the phone line from Srinagar. Go ahead.
Ma'am, I want to know, I have a query about the use of sanitizers. I have gone through some news on internet today that the regular use of sanitizers can have bad effects on skin. So I want to know how much is the reality about this.
All right. Dr. Kamat, you want to take that on? The ill effects of sanitizers, if there are any that people should be guarded against?
So I would advise everybody to first make use of soap and water. Use soap for at least 20 minutes because it's in some studies they have shown that soap is slightly more effective as compared to use of hand sanitizer. So preferably use a soap and water. Remember, the virus has some lipid layer which can be destroyed by use of soap. So and that kills the virus. So first make use of soap and water. If you don't have enough soap at home, then probably, or you are at a place where there is no soap, you have a sanitizer, then go for it. But yes, it depends on sensitivity of the skin, and skin sensitivity can vary between different patients.
All right.
So if you are having some issues with the use of sanitizer, then go for a soap preferably.
I think all doctors have always recommended soap and water as the first option, and sanitizers, of course, something that you can fall back upon. Thank you so much. That's all we have time for on the show. Big thank you to both the doctors, Dr. Kamat and Dr. Shaikh. You've been very kind, taken on all of the questions from across different parts of the country. Thank you also for calling in. That's all we have time for on the show. Thank you for watching.